Hello once again. My name is Gibson Akea. I work with the Nutrimed Care Clinic. Na leo niko hapa kuwaelimisha kuhusu breastfeeding, kunyonyesha. So many people get this wrong on how breastfeeding is done. But I'm here to actually help you. So at Nutrimed Care Clinic, we actually assist mothers, young mothers, those who have been mothers for quite some time and are breastfeeding. We assist you to understand the right methodologies or the right ways on how you can be able to breastfeed. So we have exclusive breastfeeding and we have complementary feeding. Exclusive breastfeeding, this is offering breast milk to the child or to the baby from the point of from the moment the child is born to 6 months, exclusively without offering any fluid or any solid food. Inamaanisha hata maji huyo mtoto asipewe. That is why we call it exclusive breastfeeding, and it is supposed to be for 6 months. Akifikisha 6 months, that is when you start introducing other foods, other home foods, zile vyakula zenye mnakula pale nyumbani, you start introducing, lakini you introduce them slowly. Now that is what we call complementary feeding, because at that time you find that the energy that all the nutrients that this breast milk is offering is not enough alone, so it needs to be supplemented and it needs to be complemented, and for it to be complemented ni sasa the work of that home foods, energy, the proteins, the vitamins, the minerals and every other thing. Hapo maji pia mtoto anapewa. That means mama anafaa akule vizuri, apate enough energy, enough nutrients na enough milk ya kupatia huyu mtoto during that breastfeeding period. And for how long is one supposed to breastfeed? Trust me, you are not supposed to breastfeed for less than 2.5 years. Huyu mtoto anafaa nyonye. Ikifika 6 months, anzisha complementary feeding. Aendelee alongside immunization. Asikose kukua immunized. Na huyu mtoto akiwa mgonjwa, don't just go to the chemist to just purchase the over-the-counter medications. No, that is wrong. Take the child or the baby to a facility, to the hospital, where the child will be attended to by qualified professionals, whereby the child will get an integrated management from different professionals. A nutritionist will attend to the child, a doctor will attend to the child, a health records officer will attend to the child, a public health officer will attend, a social worker will attend, a nurse will attend, depending on the condition of the child. Atashughulikiwa na specialists alongside breast milk. But if you are not able to breastfeed, suppose maybe you are working, your schedule is so rigged, remember to express. Expressing ni kukamua hayo maziwa na unaweka pale. Make sure the environment is very clean. You wash the breast, and ensure that when you are expressing the breast milk, you are expressing it into a clean container or a clean bottle. Mtoto asitumie mnyonyi. Ile mnyonyi, ya kusakol, it is not hygienically fit because it harbors bacteria. Na huwa tunaosha tunaweka tu kwa nyumba. So those bacteria mtoto atatumia na ataanza kudevelop some GIT complications, diarrhea. Unashangaa mtoto unashinda umepeleka mtoto hospitali. Why? Because of such hygiene. Now, breast milk is very important to the child. Why? Huyo mtoto anahitaji a stronger immunity. Mtoto akizaliwa na akuwe offered breast milk within the first 30 minutes after birth, huyu mtoto anaanza during that time mtoto anaanza kupewa that colostrum. Akianza kupewa that first milk iko na a lot of nutrients zenye zinasaidia huyu mtoto immunity yake kuwe boosted. Na wakati unaendelea pia kumnyonyesha, kumbuka kwamba akili yake pia inaendelea kudevelop. It helps in cognitive development or brain development. Yenye huyu mtoto utakuwa na mtoto very bright. Other thing is that huyu mtoto atakuwa haraka sana Another thing is that you when you're breastfeeding, it helps you as the mother to heal very fast, especially if you had delivered through SVD, spontaneous vaginal delivery. So uta heal haraka. It is also another method of family planning. So breastfeeding iko na a lot of benefits. Now, during the next session, I will actually teach about the right position on during breastfeeding so that mtoto aweze kunyonya maximally na asiweze kuvuta hewa, asiweze kunyonya hewa, anyonye vizuri na atosheke. We will talk about that during the next session, but for now, if you have any conditions, you have difficulties in breastfeeding, you have other medical conditions that are not that you are not allowed to breastfeed, and you need some guidance, you need to consult, reach out to NutriMed Care Clinic, whereby you will be assisted by qualified professionals, medical practitioners, or health professionals, a nutritionist and a doctor. Watakusaidia sana, utaelewa haya mambo na utafanya vitu kulingana na venye inahitajika in a healthy way. Thank you, and our numbers ziko hapo chini. Reach out, that is 0715 18 99 47 and 07 91 28 44 08. Text, WhatsApp, whichever way. At a TikTok, reach out and then you will be helped. I am Gibson Akea, and at NutriMed Care Clinic, your health is our priority. Thank you. Niponga sana.